Dusty is a cat that came here about 4 years ago. He was already infected with the feline immunodeficiency virus, which is a virus similar to the human AIDS virus, although not transmissible to humans. Transmitted by bite wounds in cats, generally found in male cats since they tend to fight more than females. And we don't know how long Dusty had already been infected with that. His first big issue occurred about 2 years ago. He had a tumor on the back of his neck. And when we removed it and biopsied it, the biopsy came back that it was something called a vaccine-associated sarcoma. In cats, they can develop a tumor at the site of vaccination when you're using killed vaccines. That's a very invasive tumor. It's one of the tumors that we have great difficulty removing in its entirety. And when that biopsy came back, after I removed it the first time, I went back in aggressively, thought we had excised it all. And a few months later, he developed another smaller tumor at in that area. At that point, we sent him to a specialty referral place to have some tests done, and they felt that there was some spread of the tumor into other areas. They recommended radiation therapy. We didn't feel that the amount of time that it potentially could buy him might be worth putting him through it, and we elected to just not do anything. For some reason since then, this tumor has not bothered him. We still don't see any gross recurrence of the tumor, which is great and totally unexpected, so we're very happy with that. Unfortunately, about a year after that happened, he developed a dental issue. Severe gingivitis to the point where it hurts, their gums hurt so much they will not eat. In October, he was sent for an X-ray to check in terms of spread of the tumor because we were considering extracting all his teeth because the gum problem had gotten so bad. We didn't see any spread of the tumor into his chest. However, we did see that his heart was a little bit enlarged on the X-ray. So we did an ultrasound and determined that he had pretty severe heart disease, really not making him a good anesthetic risk. So we're at this point going to try everything we can to handle the pain from the gum problem medically. We're also starting some medication for his heart disease, which is very advanced. He's kind of lived quite a few of his 9 lives at this point, hoping that we can get some more time out of him. He's a very happy cat. Fortunately, actually, no one has told Dusty that he's sick, which is one of the nice things about being a cat when you're sick is as long as you feel okay, you don't have to worry about it, you don't think about it. And he's eating, he's chubby, gets around fine. He's just a good old boy. You know, you could picture him with a beer, kicking back in a bar, and if he had a little too much, he'd probably get into a tussle. He's perfectly fine if you want to pet him, but if you go to hold him to get a blood test or something, Dusty lets you know who's the boss, and it's not you. So that's Dusty.